Hello, my name is Javetta King, and I will be doing my speech on congenital diaphragmatic hernia, or CDH. Over 1,600 babies are born yearly with CDH in the United States, and only an estimated 50% of those babies will survive. CDH is one of the rarest and serious birth defects that occur in 1 out of 2,500 births. I am very familiar with CDH. My granddaughter was born with it, and I have been her nurse for over 3 years. I familiarized myself and learned as much as I could for almost 5 years around the time she was diagnosed with CDH. In my speech, I will discuss what CDH is, the statistics for survival, and some of the challenges and outcomes the survivor and family may have. Congenital diaphragmatic hernia is something that happens to the fetus in utero for reasons unknown. During the first trimester, the diaphragm doesn't form or develop or close all the way. The diaphragm is responsible for separating the abdomen cavity and the chest cavity. It also aids the lungs in inhaling and exhaling. Well, when it doesn't form properly or close totally, it creates an opening. And this opening allows the abdominal organs to get into the chest cavity, preventing the lungs from growing and developing properly. It also pushes the heart to the right side of the chest. When the lungs are severely underdeveloped and hasn't grown properly, it is called pulmonary hyperplasia. And this hyperplasia prevents the body from adequately sustaining oxygen that will allow the babies to survive. Statistics show that infants with severe lung hyperplasia die regardless of the intensive care. Infants with moderate lung hyperplasia have about 40 to 60% survival rate, and mild lung hyperplasia about 60 to 95% survival rate. Although statistics show that the majority of CDH babies fall into the severe and moderate range. CDH babies require a lot of medical attention. They will have lengthy hospital stays, surgeries to correct the hernia, sometimes to correct the intestine, stomach. They could be trached and ventilated. They will have a multitude of medications. The long hospital stays will cause them to be delayed in growth, weight, cognitive, because they're not interacting or don't have the ability to meet the milestones required. So they will have physical therapy, occupational therapy, speech therapy, developmental therapy. All these things will be provided in the hospital. Once they're stable and able to be discharged, the family member or the person who the infant will live with will have to go through a series of tests, and not really tests, but training. They will have to be trained caregivers. They will have to be CPR certified. Um, they will have everything in place that the infant will need to go home and be home safely. Um, in conclusion, every day at least 4 families will be affected by a CDH diagnosis. Every baby with CDH is unique, and there is no dependable sign or indicator to predict if a baby will survive and do well or not. Parents and grandparents like myself help our children by being informed and knowledgeable and consistent with learning about CDH so we can make the best decisions for our survivors. Thank you.